Today we have an wonderful session with Dr. Shekhar Algundgi sir on insights on case taking. Dr. Shekhar Algundgi sir is a renowned homeopath and a popular teacher amongst a fraternity. In fact, he don't require an introduction. Just for the new participants, I am going to share a few brief introduction about him. Sir is practicing for more than 30 years now, and he's the founder of Swara Homeo Clinic and practices in Mumbai. And he's very much well known for his in-depth case taking and his analysis of mind and body relationship to arrive at the innermost essence of each individual, which is been very much appreciated. And he's recently introduced innovative concepts of Swara Homeo Gurukul, where he conducts regular workshops once in 2 to 3 months. And he's a popular speaker in different across India and different other countries. He's a very well-known teacher amongst fraternities I share. So without much of a delay, I would like to invite Dr. Shekhar Algundgi sir for today's session. Sir, welcome.
And in these days when we are at home, this is the best media where we can share, learn, and transform ourselves as far as understanding of homeopathy, one of the most royal science that we are. Well, the aspect about case taking, which has been dealt with by so many people, and ideally nothing basically different from what each one is doing. Only the path that each one is taking eventually towards reaching the remedy is all that makes the difference. And if you see, Christina Aguilera has beautifully said about human being, I am an ocean because I am really deep. If you search really deep enough, you can find rare exotic treasures. So let us understand the whole phenomenon of case taking. The whole idea is the art of conversation. Basically, it's nothing else but the idea of how am I conversing, being a human with other human, and to understand basically something that is not understood, something that we are not understanding what the other person is trying to tell. And most of the time as a homeopath, what we do is we try to understand what we can understand as a patient. And that is where the entire problem that we actually land up into. It is the idea is all about knowing the unknown, what we simply call exploring the unknown. So this is an art of conversation which has given birth to many queries all around globally. Lot of people have got big time problems in this particular topic of case taking. Queries such as what to do when patients don't talk, what is it to take when patients talk too much, what question to ask. At times we find it difficult. How do we know what we are on, whether we are on the right track? How do we know that this question is the right one or no? Sometimes patients get annoyed when we ask so many questions. Sometimes patients themselves will ask us the question, have we ever treated such a case? Or they might ask us, how much time does it take, doctor, for this to be cured? What do you think will be the time period? When there are something personal to tell, they feel awkward to narrate, especially when the physician is of an opposite sex or when there are students or assistants sitting next to us. Some patients are very egoistic and they may put the same question back to us. At such time, what to do? Cases of pediatric type, whom to listen in pediatric cases, the mother or the child at times. When the child is telling something, the mother disagrees. Or when the mother is trying to tell something about the child, at times the child doesn't accept it. When do we know that this is the sensation? Another very, very prominent question asked by many of them. So for me, the whole idea of this conversation is all about simply at the beginning, I would simply have a long wait, long in the sense not too long, but a couple of minutes wait before I can put the question. And mind you, every question that we are putting up to the patient should have a purpose. Many of us, when they send their cases, I ask them, what was the reason why you asked this? this particular question, you'll find many of them telling, no, I just thought maybe that is the issue for that person. And we land up into big time problem because that question doesn't make any sense to the patient, because the level in which the person is talking in front of you doesn't match to the level to what question you are asking. There has to be a sort of synchronicity between you and the other person. Without that, the issue can't go ahead. And always, what I've noticed at the beginning, the whole conversation is all about I, me, mine. I have a headache. I have psoriasis. I have eczema. And all this understanding is pertaining to an individual. And the conversation is always about I, me, mine. And this I cannot have any problem unless and until there is no you in their life. This is what I've seen. This is what I've understood. This is what I've been observing. And that you can be the person, you can be a group of people, you can be material in terms of money, house, whatever it could be. You can be in terms of emotional, happiness, joy, thrill, whatever it could be. So there is something that the I is suffering because of the you. So I normally find out what is that you, or they, them, those. That is a matter of concern for this I, the patient, or that individual who has come to my doorstep. Many a times there are so many stories that are there in an individual, and we actually miss the essence of the case, because people just simply talk and talk and talk, and there is no actual substance or content in it. These type of cases, what should be done? How to go about with this? So there are a lot of issues that come up in a case. So what I try to find out is, in this individual, what is it in that person that is the sole cause of disturbance? What is this person actually needing in his or her life? What is it that is being missed out by this person eventually that is causing a sort of stress? Commonly we see people telling you, I have got a lot of tensions, I have got a lot of stress. Basically, what is this stress? Today I can understand this in a little way, is that the way the person perceives a situation, the way the person gets emotionally disturbed with that particular situation that he has perceived, how he has perceived, the way he sees it, the way he feels it, the way he assumes it, and the way he experiences about it, and the result of that, the way it is on your physical level in terms of signs and symptoms, the whole understanding, including the way an individual copes up, makes his stress. That is his tension. Situations will come and go. Situations do not remain permanent. But what remains permanent behind that situation is the way you perceive, the way you feel, the way you imagine yourself, the understanding behind the experience of that particular situation, that remains permanent. The experience remains permanent. And this experience is nothing else but a unified form of mind, body, and soul, the trinity of life as a whole. So this particular idea, when the person begins, as I said, will begin with, I have this suffering, my body aches, my head pains, my knee joint pains. From there, they will further start telling you the story about their life. You know, doc, from the time I saw my wife betraying me due to some reasons, due to some issues, I have noticed that these problems have started erupting in me. So here, what I speak about you, or they, or them, or those, is all about that person. In this example, it is the wife that has been. This is this I's issue. Now, in what way betrayed? What has happened? How does he perceive that betray? What is the thing that is there behind? How does he get emotionally disturbed? And how does he imagine himself in this betrayal? Makes all the difference for an individual. And that's how I probe into going into understanding. So tell me about what is happening in this particular issue. How do you feel in that particular issue? That betrayal feels like what to you? So there is a huge amount of imagination that comes. And slowly, gradually, as and how you go further into this understanding, when you go probe into the experience of that particular situation, of that particular imagination, you will see the whole language then slowly starts to change into it. It is the experience of this particular issue. And when we say it, grammatically we see this, that it is something to do with substance. This particular idea is something that we are seeing in them. This is something that we notice about this individual. So the whole idea that begins simply from a conscious mind to the subconscious mind to the universal realm. And what happens, many of us, where do we actually falter, is the idea about moment the person at the beginning of the case, he uses some word. I felt there is this headache is literally throbbing. Or I felt this particular tonsillitis is killing me. We immediately have made an impression about certain things. For example, maybe it's a kingdom understanding. Oh, this tonsillitis is killing. Probably this case is animal kingdom. Oh, there is a throbbing headache. Oh, probably I can immediately start thinking maybe this could be belladonna for that matter. And these rigidized, these premeditative thoughts are the biggest form of hindrance in our case-taking process. Let it be an open mind. Let it be an understanding that I am just beginning. Let us just go ahead with whatever is coming up. Let me understand more about, rather than simply jumping into conclusion and making a whole mess of the entire thing. In this process, normally my whole questions that are there are mostly open-ended. Shorter the question, better the understand. For example, if the person is telling me that I had a problem while I was writing my exams, so I would simply ask what sort of, I would keep rest everything completely without mentioning. What sort of, for example, what sort of problem? So when you ask shorter the question, you get the better the result, because it doesn't lose the essence of what the patient is trying to tell. Normally we see many of us use too much of a lengthy question. And when you ask too lengthy question, too scientific questions, it doesn't give you the result. There are many of them who are practicing in remote areas like villages and all. People, if you try to ask, describe that type of pain. Now, what type of pain is it? People who are not educated, people who come from the village side will not understand what pain and type of pain that you're asking. Another example, tell me about your desires and aversions in food. Now you ask a poor farmer about desires and aversions. It will not make any sense to it. So therefore, important aspect is we should need to understand what is the background of where does the person come, and accordingly we have to frame our question. Many of the people ask me, sir, how do you do about people who are not educated, people who come from villages and all? The whole conversation should be, do not try to explore everything in such a way that it sounds as what you know. Location, sensation, modality, concomitant, all these things is what we know. But if we tend to ask the patient, describe that pain, describe that headache, tell which side does it pain, maybe the person will not understand what to answer and what not to answer. And therefore, the whole idea is you have to understand what is the background of it. When we do the case, remember, first and foremost, take everything as, that's what for aphorism, what Hahnemann says, the physician sees, hears, and then remarks with his other. So the whole idea is, do not use your brain, do not use your intellect. There is no scope for intellect, and therefore try not to reason out when you're doing the, try not to analyze when you're doing the case. The idea is, listen to the whole conversation. Many of us have the habit of simply Many of us have the habit of simply not at all, when we are doing the cases, we simply tend to look at the remedy. We simply tend to look at the materia medica or the repertory, and we miss out certain important information at that point of time. Therefore, I would always suggest, when you are doing the case, please do not get distracted. Complete the whole case. After finishing the case, then you can do the analysis, evaluation, whatever you have to do. Important aspect, we have this habit of simply putting in question after question. That again disturbs the flow of thought of the person. Remember to take a pause. Remember to wait for the person to answer, because in the beginning the person might be, especially in chronic diseases, patient might be having a lot of things to tell, but in that spur of moment it is not possible for the person to remember. And that is the reason why we have to only ask, what else, little more, what more do you have problems, anything else you want to mention. These type of question encourages the thought process for that individual. It gives you that space. And what I believe in this process of case taking is give that space to that individual, because that space is what makes that individual to speak out. That's what we say, silence speaks. That's what we say, do not think, be ignorant, because ignorance is bliss. Moment you are ignorant about, you will try to explore more. And that's why grammatically I say, always have commas about whatever the person is saying rather than having full stop. Oh, I understood this. If you tell the patient, I understood this, the patient will not tell you anything further. So therefore, for me, the idea here is, I didn't follow. Please describe this. When he says tight, for example, I feel tightness in my knee. What's tight? What means tight? Describe this tight. Just give some example about this tight so that I can understand properly. Didn't follow. So the whole thing is, when you're trying to explore, maybe that word will not remain that same. It might simply change to something else. And by this way, you try to go deeper. And then when the person describes it further, there you might see a whole lot of different understanding completely. That's why I use this particular comment about, at the beginning, the person will use a lot of words. It's a word network. And from that word network to something that is inner network, that is, as an individual, there is something completely different words that come in. And when you probe further, that inner network goes into a universal network. That is what we call it a sensation network, where the person will comment about something that is very strange, unique to that individual. This is possible now that we have a beautiful map which sir has given a long time back, called as the levels of experience, where the person will go from one level to other level, from the name level to the fact, and from fact to the emotion, from emotion to imagination, and further into sensation and experience level. The whole idea here is, the patients mostly begin with what their diagnosis, what they're suffering from. And from there, they will give you something about the fact of what they're suffering from. That is what we call it as the location, sensation, modalities, and concomitant. There, humanly, with this complaint, there is some emotion attached to, why me only? I feel so sad about it, doc. I feel so angry. I get really agitated. I feel frustrated about my complaints. These are the emotional set. No, PowerPoints are not there. So if these are the emotion, then the whole understanding is, find out what that emotion is for that person. How does that emotion feel like to them? How does that anger feel like to you? In that moment of frustration, how do you look at yourself at that moment of time? Because behind the emotion, every individual has a unique assumption, imagination about oneself. And if you look at the organon, footnote number 9, If you just look at footnote number 9 of the organon, Hanuman clearly mentions that the vital force gets disturbed because of imagination. And therefore, when you meditate over that, you come to awareness, and the same thing can cure you. And that's where Sir Shankaran sir has put it as delusion is disease, awareness is cure. So when the person lands up, when you ask the person from the emotional level, how does this emotion feel like to you? They go into a strange world of assumption. And that is the point of time. That's exactly the point of time when you will not be able to understand what exactly the person is trying to tell you. At this point of time, the whole idea is completely that individual has shifted into his or her own imagination. This is what we say the unique language of that person, the unique assumption, the unique imagination, the deluded state of that individual. And when you simply stay there at that point of time, without making any analysis, without making any thinking, because at that point of time, it is neither that the patient is understanding what the person is trying to tell, nor the physician can understand anything that has been mentioned. It purely comes totally out of context, out of your knowledge, out of the physician's. And that is the moment when you have to simply wait there, take a pause, look what is happening over there, read the notes what you have written it down, and then slowly get into the experience of that particular delusion. This is the turning point where many of us make a mistake, because at that point of time, we simply leave this because we do not understand it. And we go into that particular area where we can understand something, and then try to find out something that is completely coming from an individual's knowledge, from individual's intellect, from the learned knowledge. And therefore, at the beginning, what I use in the case taking, at the beginning, AT is all about acquired traits. Everything that an individual has learned, everything that an individual has heard of. And this particular idea about whatever is learned is of no use when something that doesn't make sense is something that is sensible to us, because that is completely his or her own individual understanding. So in these type of cases, in this type of situations, be careful. First of all, take a pause. Second thing, look what has been mentioned by the person. Read the whole thing. Frame your question accordingly to what the person has said, and then gradually get into the experience. So when you said this, what's the experience at that moment of time? So sometime, for example, I neither feel, doc, it's really strange, I tell you. My situation is like a doormat. Ask, what's a doormat? Someone who is completely rejected. Rejected as in, it's like untouchable. What would an untouchable go through? Because that's his assumption. What would an untouchable go through? Oh, disgust, completely shunned away. Something that is completely, nobody would accept that person, out of the community, out of the society. Describe that experience of that person. So now you go into the experience of that person. Now this patient, whatever is being describing about that person's experience, is all describing about one's own self. He or she is trying to tell the entire experience of that individual that is seen and perceived by herself or him. And once you get into that experience, you simply see a lot of patterns that are coming up. You might see hand gestures. You might see sound. You might see colors. You might see something that has got some movement. All these are the patterns of energy of that particular. Just be there. Stay there. You might not understand what is happening at that moment. You might not get head or tail of it, but just stay there. Just probe further. Describe this movement. Describe this a little bit more. So all this will give you the idea. For example, at that moment, the person will start using the language of it. It is squeezing. It is tightening. It is hiding. It is burrowing. Little bit more, squeezing, tightening, hiding, burrowing. Give all the things back again. Oh, it's black. Oh, it's blind. Quality. It is burrowing. It is hiding. And all this, when you mix everything together, in the end, you will find that there is a pattern of a substance. There is something that has to be uniquely similar to something in nature. And that is what exactly we are trying to see in an individual. And therefore, at the level of delusion, when we see cases at the level of delusion, that is the point of time which starts turning into completely non-human specific understanding. It is something to do understanding of some pattern in the nature. It can be diverting towards a plant pattern, or it can divert towards animal pattern, or it can divert towards mineral pattern, or none of these three. It could be no soul or a sarv. So when you're looking at the why I'm stressing on delusional level, because at the level of name, fact, and emotion, everything is okay. I think 90% of the people are okay till the level of name, fact, and emotion. At the level of delusion, when it comes to, that's the point of time when people start missing the link. They start missing what is happening, and it just doesn't register into them that this is something that is important. This is something which I have to look at. This is something where I have to focus at. This is something where I have to anchor at, and go from here patiently, without being in a hurry, without making haste in asking questions, by simply waiting, going gradually, and then probing, slowly probing further. It should be in such a gentle, because that's the time when you'll see a drastic. Till the time the person is at the name, fact, and emotion level, what I've noticed is there is an eye to eye contact. There is an eye to eye contact. One. Second thing, the clarity of the talk is absolutely clear, because that's what comes from the intellect. That's what the patient knows. But at the level of delusion, when it goes to the level of delusion, you will see that the person's pitch, volume, pace, sound, everything starts dropping down. There is a huge shift from the person who was just a couple of seconds before, when he was trying to tell you about something about his chief complaint, when he's trying to tell you something about location, sensation, modalities, and all these things, he had an eye-to-eye contact. He was clear about what he was trying to tell you. But now suddenly, the eye-to-eye contact is lost. Now suddenly, the pitch, volume, pace, speed of the talk is lost. And you see a drastic shift that happens. That is the alert point that you have to understand, that now I have to be cautious. I have to be, not to be hasty. I shouldn't put the question one after the other, but wait and see what is happening. Frame the question where the person is accordingly, and gradually start probing. It is simply peeling the skin out to understand the layers from where that delusion goes further into the sensation, into the understanding of the energy pattern. People ask me, do everybody actually go into the sensation? I would rather say no, very frankly. Why? Because it's difficult for everybody to reach there. Many of them have got a compensated state. Now, in compensated state, it is difficult. And then you have to use a lot of different tools in order to make the person uncompensated. Compensation is something where the person, by the act of will, tries to cover up one's inner experience. Whereas psychotic miasm also hides and cover up, but psychotic miasmatic background is where the covering up or hiding is without the act of will. What differentiates between compensation and psychotic is compensation by will, I try to hide. Whereas psychotic, it is spontaneous. There is no act of will, no act of thought, but spontaneously you're hiding, you're covering up your weakness. So in compensated cases, never ever try to push the person directly. Use different tools. Music can be, Music is one of the way how you can use for making the person decom. Or you might simply go into another area and go from there, maybe dreams. Enter from what dreams do you get, boss? Okay, fine, no problem. Don't tell me anything, no problem. Any dreams that you get? Maybe in the distant past, do you remember any dreams? You just go peripherally. What I do in compensated cases is I use different routes and different ways in order to decompensate or simply to get into that person gradually so that that person is not aware now. Because many a times what happens is due to social bindings, they just simply come to terms. What to tell you, doc? It's everybody's story now. Everybody in the family have the similar type of problems. So here, what do? I don't ask him, what are your family problems? But I would ask him, what do other family problem, others go in family problem? What sort of problem others have in family? So what is the idea is go to a third person because he has said, what to tell you, doc? Everybody's family have the similar story. Everybody have got problems in their family. What sort of problems do everybody in the family have? So that gives us that idea. That gives us a scope. That gives us a chance that you are now not asking about that person directly, but you are asking about somebody else. Because humanly, we can talk about others much more easier, much more clear, much more openly rather than talking about one's own self. This is one more thing that I tend to do when people talk about, don't want to talk about themselves and they talk about a simple casual way of avoiding the situation and just simply say, it's okay, doc, everybody faces the same problem. It's okay, doc, it's an economical crisis. Everybody are going through the same thing. What everybody are going through. That's how I would get into that thing. Some of them you will find they have this particular thing about simply over talking. In such cases, when they talk and talk and talk and talk, what to do? These type of people, how do we understand them? I normally, especially with if you're taking a case of a person who is from the medical background, let's take for example medical background. Normally they will talk a lot about their chief complaints, lot about pathology, lot about medical understanding or background of that particular complaint that they have. So they will talk the whole books of it if you allow them to talk. So in such cases, I simply take the chief complaints. If I see them talking, I tell them, wait boss, may I know what interests and hobbies do you have in life apart from this? So I divert them from the logical or intellectual talk that they're doing. How do you know that intellectual talk that they're doing? As I said, normally they will have a clear-cut understanding and you can see that they are very conscious when they're talking about their company. Some people at the very beginning, they are emotionally disturbed. What to tell you, doc, where my life is leading to? I do not know exactly how my life is leading to. What makes me happy? What makes me sad? I just do not know. I simply feel like banging that person. I get so irritated with that person, staying with him. Here there is an emotional level. Now you don't simply tell them to, oh, stop boss, I don't want to know about that. Please tell me your chief complaint. Because that person has come to you at that level of emotions. Go ahead from the emotion straight to the understanding further. So begin where the patient begins is the art. So many times I've seen my patients coming and telling me that are completely different. Some of them I don't even know the chief complaint at the time when I'm taking the case. In the end, I will ask, boss, what was your complaint that you are suffering from? Many of them they come up with a frustrated life that they're leading and directly start from there. My wife is a horrible person, doc, I tell you. What happened? No, she's not at all interested in doing anything at home. So how does it affect you? My work gets affected. Morning I have to leave for office and she's busy on the mobile. So how does it affect you? So this is a situation that is there directly at an emotional level. So don't tell, okay, forget about her house, forget about her wife, forget about her husband, whatever it is. Just tell me about a chief complaint. Please do not disturb that rhythm because that rhythm has got certain impact on that individual. And that impact is nothing else but taking you straight from that level directly to the sensation or experiential level. And many a times we have this habit, we know Okay, chief complaint we have to take, then we have to take appetite, bowel, bladder, sleep, thirst, maturation, all these things that is there as a set pattern that has been told to us from the beginning. That way you are only going to get superficial. So please, whenever the person at whatever level they are, please see to it that directly go from that level. That's where I say synchronization is very, very important, because that gives the clear understanding, because you are asking what the person is trying to tell you. You are probing at the level where the person is. This is very individualistic way of dealing. If the person has come to you, I imagine myself always being in a gutter. Now here the person is at a delusional level. Because of the skin complaints of my skin complaints, I have never had any proper treatment, doc. Nothing has worked. I've gone to several allopaths. I've taken a lot of homeopathic medications, and now I feel I'm in a shit. I'm in a gutter. So don't go into exploring the chief complaint or skin complaint. Tell me when did it start, what happened. He is already telling you that he is in such a situation. He imagines himself to be in such a situation. So go there. From there, move ahead. So these are the basic understanding how different cases present themselves in a different manner, and therefore we are supposed to be listening to the whole understanding the way these people actually talk. And let me tell you this is basically an art. It is not about information that you are gathering. It is not about technique, and those who feel it's a technique, it's not done. They will never achieve anything. It is not about any system. It is not about knowledge at all. Above all is your experience. If you feel that you are going to go into a sensation every time, sorry, forget. And therefore, if you find a person telling exclusively perfectly well about his chief complaint, do not stop him. Go ahead completely. That person is giving you exclusively, properly, perfectly about his chief complaint and everything. Wait there, explore everything, because in case if you are not going anywhere further, at least you have this chief complaint and the fact level of the chief complaint, that is location, sensation, modality, concomitants, everything perfectly anchored, so that at least by repertorizing you have your remedy there for that person. Because we normally have this idea, sensation means take everything, go ahead. Patient has said something, okay, go ahead. Never do that. If the person is like, some people are very good in telling their chief complaints thoroughly, perfectly, copybook picture of the materia medica and everything, exact rubric they will tell you. And there we simply are going ahead. Okay, so what else? So how does it feel like to be in this problem? Why you want to go ahead into the emotional level when the person is already giving you proper fact level in that at that particular point of time? The whole idea as a homeopath in the process of case taking, these are the most important things that I would like to tell you. It is not about who I am. I am nobody. It's the patient. I am nobody to understand anything. The patient will tell me. Please, boss, understand this. It is not what I know, and it is not about what I think. I might think 1001 things. Is the person telling me the same thing? It is not what I feel. It is all about, not about something that I feel something, but you tell me what you. And therefore, I use this particular dialogue in many other seminars to be a fool in the bunch of fool and enjoy the beauty of fool. This is the beauty of homeopathic practice. This is the beauty and the art in the case taking. I know nothing, you tell. And therefore, this, once we understand that I know nothing, the beauty lies in exploring. The beauty really lies in exploring. So in a short period of time, I could just give you the glimpse of how different type of people are there, how different type of understanding come in. Some people who talk more, some people who talk less, some people who project, some people who are shy and introverted. So just a short glimpse, just a short talk that I wanted to just give you in a nutshell, so that we are prepared to understand that case taking is an art. Case taking is not something that is a book that you have to have a set pattern. Every individual gives you a completely different way of talking, different thinking, different IQ level, different interests, different taste and different flavor in life. You as a physician has to adjust, has to mold according to the person in front of you. So I hope this particular talk about this understanding, whatever in a small time that we have made this everything in a way that people can understand. Yes, there are so many ways that we can go through, not being stringent that this is the only way or that is the only way. I would say every way is an important way for that individual, not for you, not for we as a homeopath, but when we mold ourselves according to that patient, that is the beauty of understanding that individual at its very best. So I really take this opportunity to thank Synergy. Thank you, Mamta, for all your this thing, and wonderful job and a wonderful thing. It was a great time meeting so many people at one platform, and I hope that you all have really enjoyed this session. Short and sweet, but a beautiful one. Thank you.
Thank you, sir. Thank you so much. I would like to share here this webinars are jointly offered by the Other Song Academy, Synergy Homeopathic, Hope, HMP, and the Prana team. And sir, would you like to take a few questions? We have
Yeah.
received a couple of questions.
Yes.
One is that how do we retake the case? Your approach in retake?
Yeah. So first and foremost, let me tell you one thing. For me, the idea about retake is simply not to go on a similar line what you have gone before. For one of the most important reason is we are opening the same wounds. If I have taken a case and if I'm not getting a result and if I have to retake, please don't begin with the same thing again. Because what happens is, first of all, the patient will have this framework in mind. I have already told you about. Second thing is, you are again opening the wounds of emotions, whatever the person has gone through in the first set of interview. Third thing, they will not go because they have already gone through that path. So what I would do is, one of the example I'll give you. Supposing if you have to make a dream of your own in life, what would you make? Suppose if there are 3 days holiday, what would you actually do? Suppose if you have to make a scenario of something that is going to be most hurting, most bothersome, most disturbing, what sort of a scenario would you create? Just in your wildest of assumption. Forget I don't want to know anything about you as such. What would you be doing what would you do if you have to make a scenario which will be most hurting? So I would just simply take it in a very peripheral way, in a very different, or I will go into other areas which I have not gone. Whatever area I have missed, probably I'll go in that area. So I will take the person into something that is very glorifying for that, something that is the person really want to do. What would you want to do if at all you are given 3-day holiday? How would you picturize this whole thing? And from there, I would get into the understanding of the case and see what was already mentioned in the first case, which I have not seen. So this is what I would never go into the case again in the same manner. So tell me, forget everything what you have told me in the past. Please tell me your complaints again. Patient will not tell you. Patient will have this idea that I've already told you this. One. Second thing is, they will not go into the same area where they had already gone before, which was hurtful, because they have to that. So they wouldn't want to go through that pain again. So for me, the retake will be go on a different path completely, totally, where you have not gone.
Okay. And there are a lot of questions which are pouring in the chat box, but we will pick up very few. Friends, because of the time constraint, we will pick up very few questions, and if sir can answer. So what are, in cases of, in psychiatric cases, where the delusions keep changing, so how do one approach in case taking?
Very important is about the observation first. Second thing is that what is the commonality that is coming up in a changing delusion? See the thread that is coming up common in a changing delusion, because there will be something that is going to be very, very important that is remaining as a main string. Delusion per se will be different, but there is some commonality that is coming up. One. Second thing is the observation that is there in that, which is very, very important to be taken into consideration, because in psychiatric cases, observation makes a huge, huge role as far as understanding an individual is concerned.
So can you please share few tips for acute case taking?
Acute case taking, first of all, the acute case taking are more or less very short, limited time that they have come with the complaint. So time is short. Therefore, the ailments form factor comes very prominently. People know, they know how did this complaint start. Second thing, third thing is people will definitely know what are their complaints, because they are already suffering in that moment of time. They know the location, they know the sensation, they know what aggravates, they know what ameliorates, they know how did it begin from. Till yesterday, doc, I was okay. So because of this heat and everything, I just pickle, and if I had a lot of buttermilk, it was a little sour, maybe, yes. And from that time, after an hour or so, I started with this irritation in the throat. Now, you know the things because the patient knows since the duration is short. But in chronic cases, many of the things are not known because the time factor being so big, years have passed, so there are a lot of things that are fossilized. But in acute conditions, ailments from all the modalities are clearly understood. And probably Dr. Gajanan Danipkar will be better to tell you about this in detail. I think tomorrow is his session. So there he will be definitely giving you the entire idea about an acute. But for me, what understanding is, you know the causative factor, you know when it started, you know how it gets relieved, you know what makes it relieved a little bit or more, what aggravates it. All these things are clear-cut, demarcated, and that becomes the most important. And your observation, again, in acute conditions, your observation is the key role, as it is, not what you want to see, what the person is doing as it is.
The next question, probably the last one, in pediatric, in children cases, how do you deal with, how is the case?
Any child above 6 years, I normally take them all alone. If the child is not wanting to stay away from the mother, then yes, I would allow the mother to stay inside, but I'll advise the mother, please do not talk in between. You just observe, you just listen, whatever you want to. We have all the color pencils and paper and everything. And the whole idea in that particular thing is, we talk like a child, we behave like a child, we act like a child. And from the school, from friend circles, what hobbies, what activities. And one more thing, what I do is, if the child is not agreeing, if you just get the initial idea when the child and the mother is together in the beginning, when they're talking and having conversation with us, you get to know that the child is not agreeing to certain things what the mother has said. I pick up those things first. I said, no child, no son, what mama was saying about this, na, even I agree to you, mama was wrong. So I try to win the confidence of the child first, so that the child opens. You know, mama was telling that thing wrong, no? I know. Soam is very good boy. Mama just like that only she tells. I didn't like it at all. Soam, you are a very good boy. You are my friend. As one of the example I'm telling. This opens up the child's confidence. This opens up the window towards getting closer to the child. And this is the entry how the child will then start. And then the child will start talking to you. So the art in pediatric cases, what I've seen is win the child first. Once you get through that, everything becomes very simple.
Oh, thank you, sir. And any few clinical tips on follow-up case taking?
Follow-up case taking, explore how the person is in comparison to what the person was before. One, again, make it a point to reach to that level wherever you had gone in the first case taking. See the intensity of that experience, of that sensation, how much intensified was it then and it is now. This gives you the idea that basically what happens in the follow-up is, you see the diluted state of the sensation. the intensity that the sensation was at the first time when you're taking the case and how much it has got diluted, that is the essence of the follow-up that you have to see. In follow-up, what you see and observe is how much is the sensation diluted in comparison to what it was before. What are the parameters that the person was telling you? How frequently that the attacks are coming now? For example, if it's headache or it's something else, how frequently is the attack? How much intensified is it? How much time duration does it last for? Is it the same as what it was in the beginning, or is it now has changed? Is the frequency that was supposed 3 to 4 times in a week before, now it's 3 to 4 times in a month? Is it that it was 12 hours before the complaint would last and now it is 3 or 4 hours? All these are the parameters that gives you the understanding how much the person is. Just don't say, how do you feel now? Better. Okay. Patient is better. And better in what sense? Better in the sense of how frequently the attacks are, how much intensity has it reduced, how frequency the thing has reduced. All these makes an another important thing. Are there any new complaints that are developed which was not there before? Keep a track of that also. That gives you the idea, is your medicine really going in a wrong direction? Is your medicine really aggravating something that was not there before? Is the complaints that are there, the person is saying, oh, my headache is gone, but I started with the abdominal complaint which was never there before. Where has this come from? Recheck your remedy. Is it that it is because of the remedy, or is it something else that has come up? So all these becomes an important criteria in your follow-up analysis.
Sir, would you recommend any books for case taking?
Case taking books. Case taking books is the only book that I can recommend is this particular aspect about live sessions with Shankaran sir at the academy, TOS. That's the best case taking.